Well, I would do if I can find the button.
Patches.
There she's in. Okay, we're now live.
Okay, welcome everybody. This is Bromford and Hodge Hill Ward Forum. Yeah, I'm one of your local councillors, Councillor Diane Donaldson, and I'm here with my colleague, Councillor Majid Mahmood. Just to let you know, this meeting is being recorded, it's live streamed and it's being recorded. We will be having updates from officers from the public health department. If any participants guests would like to ask questions, please put your hand up or indicate in the chat that you'd like to ask questions, and I'll take questions three at a time, and in order that they arrive. Can I just see who's here? So we've got Mike's here, Pat's here, we've got Councillor Majid Mahmood here. And later we're hoping to have Rachel Chapman to give us an update. Our Councillor Majid Mahmood's here now. Would you like to update on any local events? Can you hear me?
Thanks, Chair.
Yeah.
Yeah, sorry. I was just.
It's right. The sound seems a bit funny.
Childcare duties I had to. My little
sounds a bit funny. I'm not hearing very well, so bear with me.
The TV off as well.
Okay.
Can you hear me now? So
yeah,
whenever
that's a lot better.
Yeah, my voice gets worse. That's why I tend to switch it off. But there's not many people here yet, anyway. So
no.
I just want to say my thoughts and prayers with everyone who's lost loved ones during this pandemic, and all of us. I don't think there's many people that haven't lost anyone that family or a friend, and there's also my heart goes out to. There's a lot of people within our ward of Bromford and Hodge Hill who we both know are suffering from long-term effects of COVID-19. People that have caught the virus the middle of last year are still suffering. I do think we need some more work. So something that I would want to talk to the representative from public health to see what's been put in place for those who are suffering from long-term effects of COVID-19. In terms of local events, there's not been much happening, unfortunately, due to the pandemic. And we did get one bit of good news, which I have shared on social media. It's last week. I think we got notification from the planning officers of the refusal for the prior approved 5G mast on Bromford Drive, just opposite Ayala Croft. So thank you to the residents who took initiative on that and arranged for the petition, COVID safe petition, because obviously we can't knock doors and we can't hold public meetings, which is what we would normally do in times like this, whenever there's something that a number of residents are objecting to. But we managed to get, I think it was in excess of 40 signatures from residents, and that was passed on to the planning department through the full council meeting. I also made some separate representation as well as an individual around the size and locality of the 5G mast. Obviously, you can't object to a 5G mast on public health lines because public health have said that they are safe, but you can in terms of having a monstrosity outside your property or down the road from where you live, or something that's going to be hazardous to drivers. We've called this Ward Forum meeting today, as the chair has explained, primarily because Bromford and Hodge Hill Ward, our infection rates are still stubbornly quite high. This is despite all the good work of residents, and I hasten to add, and thank you to everyone that has been playing their part in maintaining social distancing and adhering to the public health guidance. But we were 6th as of end of January. I've not had the figures, statistics for this week, but I'm assuming, given that the overall trend across the city and the region is lower, that we are probably lower now than we were last week. But we were 6th highest. That's why myself and the chair decided that we would have a one-item agenda today, just around public health, to see what support we can get for residents and the continuation of the good work that Public Health England is doing. One of the biggest concerns I do have, coming from a Pakistani Kashmiri heritage, is I've saw some figures today on BBC around some statistics that are carried out in Bradford, and more than a quarter of the Pakistani Kashmiris refuse to take the vaccine. I think it's in the over 80s category. And that's quite alarming, and I'm assuming that's primarily because of the misinformation out there. So we do need to do some more work to stop the misinformation and encourage people to take the vaccine, not just for themselves and their families and their neighbours, but also for the community at large. The quicker more people are vaccinated, the quicker we can come out of this pandemic and get back to some form of normality. It was quite, I read yesterday, Chair, that they were saying that possibly large-scale sporting events and large-scale weddings may not even happen for a few years, which is going to have a massive impact on some of the business owners in and around our ward who have invested in wedding halls and community facilities, etc. I'm hoping there would be some form of package for them long-term as well, to see what else they can do.
The main thing is to get the message out there that the vaccine, it doesn't contain animal products. I think that's a lot of concerns for many people. It doesn't. I've inquired with Dr. Justin Varney, and I raised this question at the overview and scrutiny, and I've had confirmation back that the vaccine doesn't contain animal products, so it's fit for certain religious groups and vegans as well. And I think that's a lot of worry to a lot of people.
The British Medical Association, Muslim Association, they've done a lot of work around the myths and, you know, to dispel some of the false rumours. One of them is around the fact that there was a rumour going round that the vaccine was from an aborted fetus, and it also contained animal products, which, well, for a lot of the people who may have been offered the vaccine at the early stages. But as a Muslim, we believe if something's good for your medical condition, then you can override the fact that it may contain an animal product. But in this case, there's no animal product anyway, so it needs to be out there that there's no such thing as an aborted fetus in this vaccine. The other rumor that's happening, and I keep hearing this a lot, is from people saying that the actual vaccine itself contains COVID. So they're giving the vaccine to people, giving them a little bit of COVID, and then they're giving them the immunity to do that, to basically fight the virus. Then obviously there's a concern that if you're not able to fight the virus, then you're going to die from it. So that's another thing that's putting people off from taking the vaccine. I know there's some literature available from City Council, but I don't think they've got anything in Urdu yet, which is one of the languages spoken by lots of people within our ward as well, and especially the neighbouring ward End, which I think is the highest now in the city in terms of infections. I know he's having a ward forum next week, Councillor Clark, but given that you have families living across the borders here, it is quite worrying that the highest rate is.
Another what's been brought to my attention is the several outbreaks, and they're not actually in Birmingham, but they're near Birmingham, of HMOs having outbreaks of coronavirus, and that's very worrying.
A large number of people living in the same property, so if one catches it, then there's a high chance that someone else within that property will catch it as well. So it is worrying, and we don't have that many HMOs in our ward.
We don't, no.
But in the neighbouring ward, I think there is quite a few, and especially in Erdington, which is just down the road from us.
Yeah.
That's like after Selyoke, it's probably got the most number of HMOs in place, so just increases the risk to residents. We've had quite a lot of people passed away. We haven't got the actual statistics, but within our ward, I think once this is over and done with, you'll probably find that we do have a high number of deaths within Bromford and Hodge ward. I can just go by the funeral directors I know, the Muslim funeral directors who give me some feedback on a regular basis, saying that we do have a high rate of deaths, unfortunately, within Bromford, Hodge, Alum Rock, Ward End, which all families are all linked to one another. So
Yeah, you can see from your Facebook page that the amount of,
You see it on a,
yeah,
it's quite
sad.
quite scary actually waking
Yeah.
up every morning because you're just wondering who else has passed away from COVID-19. We had one death a few weeks back. He passed away. He was just on the border on Stechford Lane, on the ward end side, and his brother who lives on my road, he's still in hospital with COVID-19. It's been, I think, 5 weeks now. Still,
A friend of mine, a neighbour, she was in for 13 weeks, and since she's been out, she's sort of lost all the feeling in one arm, sort of paralysed. So
people need to understand how serious it is and take all precautions.
Yeah. Well, I can see that when I'm at Heartlands. Every week I go to Heartlands to volunteer, and you can see the amount of wards that are closed off because of COVID.
Is it true that there's some patients now that they're moving away from Heartlands to Coventry and other places just to make up the
Not that I'm
beds?
aware of.
It's probably another rumour that's going round. There is, I did hear over the weekend, in fact, someone who lives on my road told me that there was a guy handing out these leaflets on Bromford Lane around information around masks, that why you shouldn't be wearing masks, and this is part of a larger conspiracy against people effectively and bringing a new world order. But there was no, normally, you have the imprint on the bottom. There was no imprint on there where they came from. So I'm trying to get hold of one of those leaflets.
On Bromford Lane?
Bromford Lane, yeah.
By Tesco?
Handing them out at the bus stop.
Okay.
The evening, Friday, I think it was.
Yeah, at one point there was something on the island as you go down the Newport Road. There was somebody had put a poster up, a hoarding up about, and it got some misinformation on there, and it was directing people to a website, but that seems to have disappeared now.
You've got Rachel here from Public Health.
Okay, Rachel. Hello, Rachel.
Hi.
Hi.
Hi. Sorry for being late.
That's okay.
I
hope you're keeping well.
Yes, thank you. How about you?
Yeah, we're fine, thank you. Okay, so we don't have a very big audience this evening, but there are some local residents, and they're very concerned about the pandemic, and they'd just like to hear an update really about what's happening. So if you could just give us some information about.
No problem.
Okay.
So I'll try to give you a sort of general update.
Yeah.
Then happy to take any questions. Any that I can't answer, if it's all right, I'll take them away and find out more information for you, and then sort of bring it back.
That's perfect.
So for the update, what I'll do is just run through in terms of where we are in numbers, what's going on across Birmingham at the moment, give you a bit of an update around testing. We'll touch on the South African variant because obviously that's very much in the news at the moment. A little bit about the vaccine or vaccination programme, and then just finish with perhaps a couple of different ways that people can get a little bit more involved if they want to.
Excellent.
So in terms of the update, the rates have been coming down from our peak a few weeks ago, but it's important to know that the rates are still high. So if we look across Birmingham over the last 7 days, the rate is just about 290 cases per 100,000 population. Now, the week before it was about 390, so it has come down quite a lot over the week, but the rate of decline, so the rate that it's coming down, has slowed, and that is giving cause for concern. And that is something that we're seeing nationally as well as in Birmingham, that whilst the numbers are coming down, the rate of that is slowing down. The other thing to say is just to put it into context. If our rate in Birmingham is about, as I say, 290 per 100,000, at the peak we were about 800 per 100,000. But when we came out of the lockdown at the end of November, we were under 200. And that only lasted a couple of weeks before the rate started going back up again. So we need to see this rate come down a lot more before we can really start thinking about like reopening and getting back to some sort of normality. Over the summer, last summer, we actually got down into single figures for a period of time. So at 291, we're still a lot higher than where we really need to be. Birmingham, if you look at other local authorities, is the 10th highest in England for rate. So we are high. And I say our rate is 291 per 100,000. Nationally, it's 203 per 100,000. So you can see we are quite a lot higher than the average across England. And we're also high compared to a lot of the other cities across England. Having said that, it's not just in Birmingham. We're seeing high rates in other areas of the West Midlands. So at the moment, Sandwell, Walsall and Wolverhampton also have high rates. We know from the data that spread happens mainly through household and social interactions. And most of the transmission is between working age adults. Our highest rates are often in our 30 to 44-year-olds, so the sort of younger working age. So it's really important that people think about any time that they're out and about, whether it is people who have to go into work, making sure that they're practicing COVID safe working practices, or it might be travelling to and from work, you know, people are car sharing, or it might be out and about doing the shopping, or you know, when people have to go out. But that is where we're seeing most of the spread. In terms of our hospitals, they are still stretched. We still have high numbers of patients in hospitals, and the admissions at the University Hospitals Birmingham Trust, so that's across the main sites, range between 52 and 111 new cases a day over the last 7 days. So still a significant number of people still needing to go into hospital. I have got some data for specifically for Bromford and Hodge Hill, because I think it's really helpful just to understand the very local area. So the rate here is actually a bit above the Birmingham rate, so at 337 per 100,000. So in terms of numbers, the ward is 10th out of the 69 wards that we have. If we look at rates, because this takes into account the size of the ward is 24th. So it's in the higher half in terms of rates of COVID. We see the same pattern here as we do across Birmingham. So the majority of cases in the working age population, and more of them in the 20 to 39 age group than the 40 to 59 age group. So it is that younger working age population. And just over half in Asian ethnic groups. I don't have a breakdown any further than that, but we do know across Birmingham that we do see disproportionate numbers of cases in our ethnic communities. In terms of moving on then to testing, we have 2 different types of tests for COVID. So anybody who has symptoms of COVID needs to stay at home and book a test through the NHS website, and this is a PCR test. And they say this is for anybody who's got symptoms. For the PCR test, we've got a couple of drive-in sites in Birmingham, and there's also the walk-in sites, or you can have the postal kit delivered. And with PCR, it's a swab up the nose and down the back of the throat, and the result takes a day or 2 to come through because it needs to go away to the lab, they process it, and then you get the result back. The other type of test we have is called the lateral flow test, and this is for people who haven't got symptoms But what we want to do is test as many people in the population as we can, particularly the people who have to go out to work. So people who can't work from home, who are having to go out to work. We're asking those people, if they can, to access lateral flow testing twice a week. And the reason for this is lateral flow is very good at picking up people who are infectious but perhaps don't know about it. So we've heard nationally that about a third of people with COVID don't have any symptoms, but unfortunately they are at risk of spreading it to other people. So by people getting a lateral flow test, by doing the lateral flow, we're able to identify people who have got the virus but don't know it. And then what we're able to do is talk to them about self-isolation, ask them to self-isolate and their family, which then reduces the spread. For lateral flow, we've got a main site at the NIA, and this is a walk-in site. You don't need an appointment. You can go and get tested there, and this is where we're asking some of our frontline public sector staff and the public to go, and that's working really well. There's usually no delay for that. We also have some community sites. These are fixed sites. I think we've got 4 up and running now. With these, you do need to make an appointment, which you can do through the Birmingham Council website. And then in addition, we have 3 mobile sites. They're at Castle Vale, the Arcadian Centre and Maypole Youth Centre. When we say mobile, it does take a few days to set them up. So they sort of move into an area and stay there for a week or 2. Just to bring additional testing capacity into those areas. But for all of these, you can just book an appointment through the website. In addition, we have pharmacies coming online. And again, these are on the council website, so you can book an appointment at a pharmacy to get tested. And we have been starting to set up testing sites in different workplaces, and the government announced over the weekend that any business with more than 50 staff can actually register directly on the Government UK website to set up lateral flow testing for their staff. So I'd just like to encourage anybody in the ward, anybody involved with the ward forum, if you are a business owner or involved in a business and there's more than 50 staff, then we'd strongly encourage you to register so that you can start to test your staff regularly. And this will really help us to pick up cases that people who wouldn't necessarily know that they were positive, but then we can further stop the spread of COVID. If I move on then to variants of COVID, and because there's obviously a lot in the news at the moment about the South African variant, we know that viruses mutate. There are usually many variants of viruses. Sometimes the variants aren't, they actually don't give the virus any advantage at all, and those variants die out. Some variants actually give the virus an advantage, and these are the ones that we call variants of concern. And this might be because they're easier to transmit between individuals. It might be because they give a more severe disease, or it might be that they have an altered response to the vaccine. So all the time we are watching for variants and studying them to see what difference it's making. So far in England, well, in the UK, we've identified 4 what we call these variants of concern. We've got the Kent one, the South African one, one from Brazil and one from Japan. Now, certainly with the variants of concern from abroad, if anybody, it's linked directly to recent travel, then individuals need to isolate. Now, what's happened with the South African one is that it's been found in individuals who haven't travelled back from South Africa. So they've picked it up from another contact, which suggests that it is started to spread. And that's why there are pockets now of very intensive testing where we found examples of the South African variant where it's not linked to travel. so that we can understand if we've got more of that variant in that local community. And we have 2 areas in Birmingham where we're doing this. So Frankly Great Park and the south bit of Northfield. And this has been up and running now for a few days, and we're asking anybody who lives or works in either of these areas to get tested. Now, this needs to be through the specific testing program for the South African variant. So I'm flagging it here because it's not about going and getting a regular PCR test or an LFD test. It needs to be through the specific program for this, and it's called Operation Eagle. All the details are on the Birmingham Council website, and the reason is that these tests have been sent off to a different lab where we can very quickly find out if they're linked with the South African variant. If I then move on to the vaccine, so obviously the vaccination programme for COVID is rolling out, and I think the news, I don't know if it was yesterday or today, was that 12 million people had their first vaccine. The focus for the vaccination programme is on preventing serious disease and death. And that is why the key target groups have been identified. And this is the approach that the UK is taking based on the recommendation of the JCVI, so the Joint Committee on Vaccination and Immunisation. The uptake across the West Midlands has been good. However, we are concerned with certainly national data that there are some groups within the population who are less likely to take up the vaccine, especially those living in perhaps more deprived areas or from different ethnic backgrounds. So this is something that nationally and locally we're working on to make sure that everybody's got the right information about the vaccine. Obviously, we're very aware of fake news and fake news stories that are out there. So we want to make sure that everybody's got full information about the vaccine so that they can make an informed choice about taking it up. So in terms of prioritisation, initially vaccination, it was aimed at our care homes and our care home workers because that's where we had very high rates of mortality in our care homes. And then working down, so over 80s, over 70-year-olds, NHS and social care staff and clinically extremely vulnerable. And I think the aim is that in the next couple of weeks, we've completed those groups and then start working down through the younger age groups down to, I think at the moment, the aim is to have all everybody over the age of 50 to have had their first dose by sometime in May. Really, really important message here is that even if you've had the vaccine, it is still really important to follow all of the COVID safe measures. So frequent hand washing, wearing a face covering when you're out and about, and keeping that 2-metre social distance. And the reason for this is with the vaccine trials, there's really good evidence that the vaccines, and it doesn't matter which one you have, that what they do is massively reduce the chance of getting serious disease, serious illness and dying from COVID. What we don't have a lot of information about yet is how much the vaccines also prevent COVID from spreading between individuals. That evidence is starting to come through, and there has been some sort of promising information on that. But whilst we still have high levels of COVID in the community, we are still very much rolling the vaccination programme out to individuals who are at higher risk of becoming ill. The messages about hands, face, space, and socially isolating and staying at home unless you need to go out are just as important. As I'm sure you've heard, we're getting as many people as possible through the first dose and then the second dose 12 weeks later. In terms of the South African variant, there was something in the news, again it was yesterday or today, concerns about the vaccine and whether it worked against the South African variant. And actually this question is asked about all new variants as to whether the vaccine will still work. All of the evidence we have shows that the vaccine does still work and prevent severe disease from the South African variant. What we don't know is whether it's as good at stopping the transmission of the virus. But the key message here is it is definitely worth getting the vaccine, possibly even more so with the development of these variants. So anything that we can do to encourage people to take it up, I think is really, really helpful. If I then just move on, just a couple of things to mention that people in the ward can get involved in. One is the Covid Champion Programme. We have over 600 Covid champions to date in Birmingham. Our target is 1,000, so we would very much like to get some more. And by being a Covid champion, what you can do, and this can be anybody, if you sign up to be a Covid champion, it means you can receive regular updates about Covid. So any changes to local national guidance, new services, useful information on how to stay safe, all sorts of information. You get invited to exclusive webinars with topic experts and the opportunity to put questions directly to the team, and then also share your own experiences. And all that we ask is that you share the information that we give you with as many people as you can. But then, as I say, it's very much that two-way conversation that you're able then to come back to us and say, well, actually, that information was really helpful, that worked, but the questions I'm getting asked are these sorts of things. So anybody who would like to be a Covid champion, you can sign up on the Birmingham City Council website. And the other thing just to flag, we've had a whistleblowing helpline for quite a while, and this has been really successful, but we want to continue to promote it. So if anybody comes across situations, particularly workplaces, where they don't feel that people are following Covid safe measures, please let us know. What it means is we can get in touch with the workplace, we can try and offer support, we can work with them to try to improve Covid safety so that we can reduce the risk of spreading Covid in those environments. So as I say, Covid champions, brilliant if anybody's interested, get signed up. And also whistleblowing, let us know if you see problems out there so that we can do something about them. So that's the sort of a bit of a canter through. I'm sorry, it's a lot of information in a short time.
Thank you, Rachel. A question I would like to ask is, if you're offered a vaccine, the first one that came out, the Pfizer BioNTech, and then by the time the second vaccine comes around, about 12 weeks later, and you're offered a different one, is that going to make any difference?
It's actually a really good question, and there is a trial that has started to look at that to see whether it makes any difference, or even if it might be more effective. We don't know yet. I think it's fascinating that we've got different vaccines that have been produced in different ways, and at the moment we know that all of the vaccines that are out there are effective. What we don't know is that if we combine them, are they more effective? So there's a very rapid piece of work going on looking at that at the moment. I would say at the moment, to anybody out there, whichever vaccine you are offered is absolutely worth having. I think there was a little bit early on where people wanted to wait for one or the other. I'd say absolutely don't. They all work. So whichever one is available, it's better to get it now than to think about waiting for what might be available in the future.
Right. And will the other new vaccine be offered, the Moderna vaccine?
Yes, so that's coming through as well. As I say, I think it's going to be really interesting how this works out over the next few weeks and months in terms of how we schedule the vaccines and availability. At the moment, it's being done on what's available.
Okay, I've got a question here. How else can residents access the information or make appointments if they haven't got access to the internet?
That is a good question, and I'm sorry, I haven't got that off the top of my head, but I will find that out for you. I will have to go to the internet to find out the answer to the question.
Right. Do we have any more questions? Anyone?
Councillor Mahmood's got his hand up, Chair.
Oh, okay. Councillor Mahmood.
Yeah, thank you, Chair. I've got a few questions for the officer. First of all, thank you to Rachel for attending our ward forum meeting. I know officers in public health are probably the busiest they've ever been during their professional careers. And Rachel's still smiling, so thank you. There's a couple of questions that obviously as councillors, we get quite a lot of people coming to us who prefer not to go to other agencies, and we tend to be their first port of call. And I've tried my best to encourage people to sign up as COVID-19 champions. I mean, I'm signed up and a couple of my friends have signed up from Bromford and Hodgehill. It's really useful because we attended a meeting today as well, just before this meeting, around the vaccine programme. But last ward forum meeting, we had Dr. Varney. He said we had 11 people signed up from the ward. Do we know if that's increased at all, or is it still sitting at 11?
I will have to go back and ask for you. So I'm not sure. Every week we do see it going up a little bit, but I'm not sure specifically for this ward. So I'll double check where we're up to. What we've also worked out is how many you should have. So we've shared the 1,000 across Birmingham. So I can tell you what we're aiming for.
What's our quota?
That would be really useful if we could have how many we've got, say, across the city in terms of different wards, and then how many you feel that we should have in the ward as well. That way we can use that data and say to people, come on, sign up, because we haven't got as many COVID champions as we should do, and other wards have got more than us. We arranged this forum meeting today after we found out Bromford and Hodgehill was number 6 in the city. That was towards the end of January. I think we've come down to number 10th in the city, which is still on the high side in comparison to other parts of the city. So we do need to do some more work, try to bring that data down. You mentioned about whistleblowing of businesses and workplaces and other people who are in breach. Do we have any statistics in terms of if we've had reports from this ward? Is it broken down into wards, or is that something that's available?
I've not seen it, but I can certainly ask for you if those data are available.
So because we've started a naming and shaming of fly tippers in the city council, so I was just thinking whether we could have the same as well if there's any workplaces that are continuously in breach. It's a matter of keeping people safe. The ones that I'm really concerned about is ones where people are able to work from home for whatever reason. Their bosses prefer them to come into the offices or the workplaces. That's one that of most concern to me. And secondly, obviously, if they haven't got a proper track and trace system in place, and that's something that really does need to be looked at, because if it's affecting customers alike, because one of the things that's been brought to my attention lately is you have these click and collect services in a lot of the shops. Like, for example, you've got the Fort shopping centre, which is just around the corner from Bromford and Hodgehill. You have the click and collect service, even at the large stores like the Next and stuff. And the queuing systems there, a lot of them don't have social distance, and a lot of people don't wear the mask because I think SAGE recommends that you should be wearing masks outdoors, but we haven't implemented that as a city or as a country. But you see people in the queues not wearing the masks. And then also you've got around Ward End and Alum Rock, more so than Bromford and Hodgehill, you've got the outdoor markets. Some sell fruit, some sell other products. And again, people don't have to wear the mask because there's no legislation asking them to wear the mask. There's no guidance actually given on that. I do think there should be some guidance given by the City Council as to what measures should be put in place by the businesses themselves in order to have social distancing maintained and ensure that people aren't touching the same products over and over again, because then there is a risk of it spreading. And the other one I wanted to just flag up on, I did have I'm not sure if this is the appropriate word, a Twitter conversation with Dr. Varney. That the community pharmacies we've got in Bromford and Hodgehill Ward, we've actually got 2, Jute's Pharmacy. They're offering the testing, the lateral flow device testing. but the listed has been under Castle Bromwich on the Birmingham City Council website. And Castle Bromwich is an area just bordering Bromford and Hodgill in Solihull Council. So just don't want people confused, because there's literally hundreds of Jutes pharmacies spread across the city. So we don't want people to be confused that when they're looking for Bromford and Hodgill ward, they come across Castle Bromwich and they don't even click on to Jutes Pharmacy, Castle Bromwich, thinking, well, that's the site in Castle Bromwich. So then we tend to miss out. And then if there are, we did suggest to Dr. Varney, I think this was last week after a conversation with the Cabinet Member for Health and Social Care, Councillor Paulette Hamilton, that we should have more testing sites for both those with symptoms and those without symptoms in and around this part of East Birmingham, so Bromford and Hodgill, Warden, Alum Rock, Small Heath. And we suggested about 10 sites between us as councillors. There's about 6 of us, but we've not had any feedback yet on those sites, whether they could be used. Because in Bromford and Hodgill, we've got a couple of car parks, which I think the City Council own car parks, I think they would be ideal to use. There's a Collingbourne Avenue car park on Collingbourne Avenue, and then there's also a car park on Bromford Drive next to the former social club, a community hub now, isn't it? There's 2 sites there that could be quite easily be set up for lateral flow device. Because within, if you look at the population in Bromford and Hodgill, you've got a large number of public sector workers within Bromford and Hodgill who aren't able to work from home and have to go to work, and they're the ones that we really need to get testing, the ones with no symptoms, to ensure that they're keeping themselves safe. If that could be looked at, that would be brilliant for people in this ward. And the other thing that I wanted to flag up, which is most concerning, I read it yesterday on the BBC website. Bradford has similar demographics to Birmingham in terms of different ethnic minority groups. For example, here in Birmingham, you've got a quarter of the population originates from Pakistan, Kashmir, and it's the same in Bradford. Now, a study in Bradford said that over the people over 80 within the Pakistani Kashmiri community, only 46% of them have been vaccinated. And more worryingly for me, nearly 24%, nearly a quarter of them refused the vaccine when offered. And if we've got a similar trend in Birmingham, I don't know if the same researchers have done the work in Birmingham, if that could be, that information could be shared with elected members and other agencies, then with community groups, so we can have an effort in trying to encourage people to take the vaccine. I know we've had an email today. Something that I suggested to Dr. Varney and Councillor Paul Hamilton is to have a video with councillors from the Black, Asian, minority ethnic community, to do a video just encouraging people to take the vaccine and letting people know it's safe, not to look at the myths and the false rumours that are going around the community, because rumours spread, and especially now when a lot of people are at home. One rumour starts and all of a sudden you've got a whole community refusing vaccine. I know of a few people who refused the vaccine in the initial stages, but now want to have the vaccine because they've realised that they made a mistake. Then I think today it was mentioned on TV that if you're over 70 and you've not had a vaccine, you can just call 119 to get the vaccine, to get yourself booked on, as opposed to you waiting for the vaccine. So that type of information is really, really useful. That's something that needs to be cascaded down to the communities. If that can be provided. Oh, and the final point I want to raise, this has come up as well from residents. If you're a resident of Birmingham and you go abroad, obviously holiday, going on holiday now is illegal, but if you go for any other reason, are you still do you still have to adhere to the public health guidance and social distancing that is legislated for us in this country when you go abroad? So for example, if you go abroad and you attend a sporting or non-sporting event with hundreds of people, because what's happening in the Asian community, you've got people who are abroad and they're attending these type of functions, events, and the people here think, oh, it's okay because there's nothing happening in Kashmir, there's nothing happening in Pakistan, there's nothing happening in Bangladesh. But that's because they're not a developed country. They don't have the data that we've got in this country and other developing countries. And I do think we need to have some form of public information given to people who, because the majority of people who leave the country, especially ones with families in the Indian subcontinent, they do so because of funerals or because someone isn't well. But then there's also a minority that flout that and they go for other reasons. We do think we need to call them out. Thank you, Chair. I think that's more than enough from me.
Thank you, Councillor Mahmood. I think there's a couple of those if I could just pick up. In terms of the sites that you mentioned, I have been trying to follow that up today, and we'll continue to do that tomorrow. In terms of understanding where we're up to, what has been looked at, and where we are with that. So it's in hand. I just haven't got an answer for you at the moment. In terms of your comment about the poor vaccine uptake, particularly in some of our ethnic minority groups, that is obviously a massive concern for us, particularly in our most elderly, therefore most vulnerable populations. I think anything that we are able to do in terms of promoting the correct messages about the vaccine, giving people the right information so that they can make a more informed choice, is really important. And also your point about that that visibility, people from their own community being, talking about it and being able to share their own experiences of it. I'm sure you're aware that Justin does quite a lot of work already with the faith leaders. Yeah. And there was a meeting this morning that he was at, and I was also at, and the discussions there are incredibly useful, and I think we just need to carry on and do as much of that as we can. And there was somebody, there was a comment and a story, and I think people's stories are actually often more powerful than all the facts and figures that we can give to people. And it was somebody within the community who they hadn't been sure about having the vaccine, and then they sort of gathered the information, they'd made the decision to have it, and then really celebrated the fact that they'd had it and told all of their friends, and then all of their friends wanted to get it. And actually that sort of messaging, I think, within communities is incredibly powerful. So anything that we're able to do with that, I would certainly welcome. And I will pick up your point about people who've changed their minds, and just make sure that we're getting messages out to people about what to do in those situations. Because yes, I understand that sometimes people need to think about it for a little while. They'll get more information, they'll hear about their friends, their neighbours, whoever is having it, and actually then want to go ahead. So we need to make it as easy as we possibly can. And then also I'll take your point back to the communications team about people who are returning from necessary trips, and what that means, what risks they might have been exposed to without perhaps realising it, and what that then means for when they're coming back.
It's a good initiative, but I think it's Al Abbas Mosque in Borsleith, where they've now become a vaccine hub. If that could also be, because I know you have the faith leaders meeting every Monday, if potentially we could find other religious institutions who are prepared to open their doors to becoming vaccine hubs, I think that would be extremely helpful. I had my dad's relative, my uncle, he's a senior imam in Dudley. He's been an imam there for more than 40 years. He had the vaccine over the weekend, and he sent me a photo. Then I publicised it on social media. I had 4 people call me who were reluctant to send their parents for the vaccine. They said, because the imam's taken it, and we're now going to send them. I think we need to do more of that as a city council as well. If we can, we did have a councillor, Councillor Shanina Mughal. She works at the Women's Hospital, and because of that, she's healthcare, and she was offered the vaccine. She took it, and again, we had her photograph, and we publicised that as well. And it's gone down quite well, because people want to see their own people having the vaccine. They don't want to say, okay, we're here, millions of people have had the vaccine, 12 million, but how many of the 12 million do you actually know? Once you've got someone who it works. We had a 94-year-old who chaired knows, Eileen Collins, very active member of our community. Now she's quite elderly, so she's not as active as she used to be, but she's partly responsible for me being a councillor. She wasn't offered the vaccine initially for whatever reason, and then we made some contacts with NHS, etc., and then she got offered the vaccine. She's 94 years old, and she took the vaccine. She said, look, she actually asked me, she goes, look, can you put my photo, and then we can publicise that as well. And that worked as well because people,
Yeah.
well, Ireland's had the vaccine, so we can have the vaccine.
I
Safe, and I think
publicised for my
more of
mother
that.
as well. She
Yeah.
had she's 86 and she had the vaccine when it first rolled out, and I publicised it and encouraged quite a few people to take it. So
Well, I do think we need to make it easier for those who refused it initially, but I do really want to have it because they may be missed in this race to get everyone vaccinated. We don't want those who refused initially, because then the GPs and NHS CCG might think, well, hang on, they don't want it, but hang on, they've changed their mind and they're more vulnerable than others. So we do need to approach them. The other final question around this: there's a number of people who have been vaccinated because they put themselves on Facebook and Twitter who don't meet the priority groups, i.e. they're not frontline NHS workers, they're not within the groups that we've seen, because we've all got the graph of you have to be over 18 and 75. How do they get the vaccine? Because I'm hearing that the GPs just contact them if they've got a large batch of vaccines where people refuse to turn up. Is there any credibility to that in terms of, do they call patients themselves to ask them to come in for the vaccine? And if so, is there a way of us informing people who would want to have the vaccine but have not received it and not in the party? I'm going to have to wait till probably August or September for my turn.
I've known people who've been offered the vaccine, and the GPs just rang them up and they said people haven't turned up and we've got so many vaccines left for today.
What's the criteria for that, Chair? Because people ask me and say, well, hang on, he's had the vaccine, his GP called him, how come my GP's not called?
They've just got a list.
Does the CCG have a list themselves that they have for?
No, the GPs have a list and they'll just ring round off the list until they'll get somebody, rather than throw that vaccine away.
Yeah, no, I get that.
Because once the vial's open, so they'll just ring down the list, until they find someone who can just come in on the spur of the moment.
There must be a formula document. Do we give guidance as public health? Does the CCG give guidance? Or is it down to the GP themselves to basically pick and choose which patient should receive it?
From what I understand, I think it's the GP.
I think it's been a reasonably pragmatic solution, as Councillor Donaldson says, rather than throw the vaccine away, which would be awful. I think it is just about, as much as possible, the planning is done to say, right, we've got this many people, we need this much vaccine, but then at the end of the day, if there's a few left, better to vaccinate somebody than throw it away.
Yeah, I get that. So it's down to the GPs then to devise their own methodology on who's the lucky one who gets the call.
I think the important thing is we're really targeting those key groups, so that that's where the vaccine is absolutely being targeted to. And of those 12 million, that is, I think it's a fantastic achievement that we've done that many.
Excellent. It's brilliant.
We can't knock the government in the manner in which the vaccine has been rolled out. Trust the NHS; they will deliver for you.
I wanted to ask about the vaccine and the variants. Are the vaccines, well, the especially the Pfizer vaccine, which was one of the first ones to come out, how does it cope with the new variant, the South African variants?
There is still work. This is very new, obviously, as you know. And as a new variant appears, then the vaccine teams are very rapidly trying to work out what impact that might have with the vaccine. So far, all the information that we have is that all of the vaccines still work against all of the variants in terms of preventing that serious illness or reducing the risk of getting the serious illness or dying from COVID. What's not quite as clear, and particularly with the South African one, is how well the vaccines prevent the transmission between individuals, partly because we're still working this out, but the anxiety with the South African one is the vaccine might not be quite as good as stopping it from spreading it from individual to individual. But it's very early days for that information. As I say, it absolutely still works in terms of reducing the risk of becoming very ill. But they are still investigating what impact it has on transmission, and how much it reduces that, and it might not do it as much. And that's why this message about, if you've had the vaccine, still do everything, still be COVID safe. It's not a sort of, there you go, you're done, you're fine. You still absolutely need to follow all of the measures, partly because of this. The other thing to say is, because of the way the vaccines have been developed and all the work that's been done, the teams are already looking at newer versions of the vaccine. So it won't take as long to develop the next version of the vaccine and the next one. So as the virus mutates and gets variants, we will be able to keep up with it going forward, so that it won't take 12 months to create a new vaccine against a new variant. And they describe it as plug and play a little bit.
Okay. Do you foresee that in the future we'll be having a vaccine every year, a COVID vaccine every year?
And again, these are the questions. Yeah, absolutely. These are the questions that are being asked. Will we need to do that? We know that flu changes and that we need to get a flu jab every year. And it might be that we need to do exactly the same with COVID. At the moment, we don't know how long the immune response lasts after you've had the vaccine, just because it hasn't been around long enough. And we could easily end up in a position where, yes, you're getting your flu jab, you're getting your COVID jab. We will get more information on that over the next few months.
Okay, thank you, Rachel. I'll just put it out to any residents out there if they want to ask any other questions. No, I think we've asked all the questions. Thank you, Rachel. I don't think there's any. I think we've covered most of the topics on COVID and the vaccinations, and it looks like we're going to be having COVID. COVID is not something that's going to disappear at the end of the year. I think we're in it for the long haul, from what I can gather. So we must continue to wear our masks, take all the precautions, distance ourselves, read if you're sign up to the COVID champion, so you can get all the updated information and share it with your friends and family, so we can get on top of this, and hopefully we can get back to having some sort of normality in the summer.
It's what we're all hoping for, isn't it? Yes.
Okay. Well, thank you, Rachel. Keep up the great work. You're doing an excellent job.
Thank you very much.
Okay. Thank you.
Have a good evening.
And
bye.
Bye-bye. Bye.
Bye-bye.
Bye, Rachel.
Bye.
You want to just raise any other business, Chair?
Yes. Is there any other questions that residents would like to ask about any other topic that's a concern in the ward? No.
I think everyone's a bit shy, Chair.
Yeah. Well, they've fallen asleep.
No, it was a good session. No, it was a good session. Thank you to Rachel. It was really, really useful information that she gave. And the trajectory is downwards now. She mentioned that we're 10th now in the city from 6th last week, so we need to keep it up. But we need to remember we also have lots of multi-generation households in Bromford and Hodge Hill, and a lot of our people in the ward do work on the front line, so we're more exposed to catching COVID-19. I think
there are multi-generational households, but there are a lot of HMOs, and I think that's not being looked at as much as it should be. I don't know how, because it's working age people that normally live in HMOs, and I think they're at the high risk group. So I think we need to do more work around that.
Authority to act as chair to the next meeting, or have we got a date for the next meeting?
We haven't got a date for the next meeting. as yet, but we'll circulate that as soon as possible.
Yeah.
Okay, well, thank you everyone for attending, and it was an excellent presentation by Rachel. And we look forward to seeing you all at the next Bromford and Hodge Hill Ward Forum. Thank you, everyone.
Yeah. Thank you, everyone. Thank you, Chair.
Thank you. Thank you. Bye-bye.